Hello my good friends, if you are watching this video, I know that you are looking some very specific information about this little kit here, right? So this video actually is a small tutorial for you to get some tips, how to use them, how to take the best from this kit that in my opinion is one of the most precise and delicate tunnel instruments that you have available in the world. This kit was developed for the need, right, to accomplish something that we do not was accomplished using different kinds of instruments. So the need brought us to design this kind of instruments, and in this video I'm going to explain to you step by step how to use and how to take advantage of each of these instruments here. Okay, I'm going to present for you guys one clinical case, and using this clinical case you're going to really understand what I need to do for accomplish that. It's a tunneling case. You see here small recessions, different color of the gingival profile of this patient. The cause of this difference in the color shade is because the gingival thickness is of course not enough to block the difference in the color that you have in the root structure. So a very dark root with minimal thickness of the gingiva can be seen by transparency in the surface. We also know that when we increase the thickness of the gingiva up to 2 millimeters, I can block any difference in the color what is in the base. Okay, so I can have a dark root, I can have a titanium abutment, and if I increase the thickness of the gingiva up to 2 millimeters, usually you can completely block the difference in the color. So one of the goals of this surgery here is to change the color appearance of the gingiva, and also to advance a little bit the margin on the recession to balance that a little bit better. Okay, so in this clinical case here, first of course we have the prosthetical preparation of this patient. We remove the old crowns. If you never heard about BOPTO, biological oriented periodontal therapy, it's one very nice synergic therapy that you can approach for your patients together with soft tissue grafting. This helped me a lot to achieve my goals here, but you're not going to have the time to approach this, maybe in a secondary video. And here's the deal. Okay, now is the time for me to start to prepare the recipient side to receive connective tissue graft, okay, to improve the thickness and also to support the new corner advance of this margin. We're going to do a tunneling approach. Actually, the option for tunneling here is quite obvious because I don't have long recessions. The recession is a little bit shorter than 2-3 millimeters, so I do not need to have huge manipulation and advantage. Very specific indication for tunneling. If you decide to flap, of course it's your also call, is doable, but I think here better options could be really do tunneling. So first thing, what we do when we start the preparation, we cut the sulcus with a microblade or a blade, or we just detach it. That according to the phenotype of the gingiva that you are working with. In very thin gingiva, I prefer just starting detaching the sulcus instead of doing incisions. Even the most delicate microblade sometimes in the sulcus, when the gingiva is very thin, can already cause some damage on the gingival margin. So what we're going to do here is to get tunneling instrument, and you're going to rotate the tunneling instrument inside the sulcular area. And here is the first one instrument that I'm going to start to show to you. Okay, in this kit here you're going to find a few different instruments. Two of these instruments, they are like regular tunneling instruments. I hope that the focus of the camera is going to be enough for me to try to show you guys, okay? But these instruments here, they are minimal size, okay? Let me try to put my finger here. They are very, very tiny, and you're going to see that I have a straight side and ungulate side, and two of these instruments, they are very similar to each other. The difference is one is super tiny, super delicate for you to deal with, like lower incisors, small areas, very thin phenotype, and also to detach the sulcus as you are seeing here in this picture, okay? The second one is basically the same design but a little bit larger than that. Is a tunneling instrument that is really already, let me go closer once more here to focus. It's a tunneling instrument for you to start the detachment of the sulcus already, okay? So first step, what you're going to do for our case here is to start just detaching the sulcus using the tunneling knife number 1, the micro one being very delicate with the gingival margin. And here we go, the tunneling knife number 2. You see that the difference is the size. If I can get here from the previous slides, you're going to see how delicate is the first one, and the second one already is a little bit larger. When we start to do the detachment of the tissue, there's also a few discussion. Ricardo, we do full thickness or partial thickness. Okay, especially in the center of the area, especially in the center of the recession, we always recommend for you to do full thickness detachment to preserve the blood vessels, to preserve this tissue stronger, so full thickness detachment. And sometimes when you are doing full thickness detachment and gingiva is very delicate, you are pushing the instruments, you are afraid for the instruments to perforate the flap. So one thing that we need to use in favor not to destroy the tissue is the movement of the instrument. The instrument must not just be pushed forward. The instrument must to give small like tilting movements, walking the instrument side by side in order for the instrument holding in the bone, lift one border. When you lift this border, you gently detach the periosseum 1 millimeter here. When you lift the other border, you gently detach the periosseum in the opposite side. This way you can move the instrument forward, doing this small tilting movement, and you can lift the most delicate areas, okay? That is the reason as well that you're going to see that these instruments here, they have very specifically handling, okay? This handle part is unbelievable, amazing. It's round, it's easy for you to do the rotated movement that I just mentioned for you. The weight of this instrument is perfect. It's not a super heavy instrument, it's not a super light instrument. It's going to balance pretty well in your hands. If you already hold off of the instrument, you can feel the sensation. And one of the interesting part for you to know about is that the handling part, when you are develop these instruments, we are designing this instrument, we need to come up with a new design of the handling. So the inspiration of the handling part here is the suction cups of the octopus. So when you see the octopus, you see the suction cups here, and the idea to use a hard surgical silicone for that is not just to hold you on the grip, and also the suction cups make an outstanding visual for these instruments as well, okay? So second step is going to manage the full thickness detachment. And now we can already present for you guys a few more options of instruments. Beautiful. This is very good. When we detach the full thickness part and you are doing tunneling, one of the restrictions that you have for advancing the tunneling usually is not the work that you're going to promote apical. Okay, when you release the tissue apical, detach, cut the muscles, and you can really lift the tissue. The great restriction for tunneling is the papillas, or are the papillas, sorry. Because you do not cut the papillas, when you lift this tissue, are the papillas that hold the flap not to be advanced properly. That's why longer or higher recession than 3 millimeters, sometimes tunneling start to be a problem for you to deliver the margin properly. So I use as a reference 3 to 4 millimeters to opt between tunneling and sometimes to flap a case, exactly because of these reasons. But one thing for sure, if you can already start to detach the papillas, okay, from the buccal bone and from the top of the crest, you're going to give you more mobility for this flap, treating longer or higher recessions. And not just that, according to how wide is the papilla that you are manipulated, also you start to open the possibility for this space to be grafted as well. Okay. What is the big thing about this? To do this in the papilla is very risky. When you are detaching the papillas, you risk to destroy the papilla, you risk to compromise the blood vessel. So first thing, I need to understand in which case the papilla can be manipulated, and I'm going to tell you in a few slides some anatomic reference for that. And second thing, I need to use delicate and proper instruments to do this job. So the instruments that you are looking now in the screen here is a papilla elevator. This papilla elevator, it's a very weird instrument. You see the curvature of this instrument, but this weird instrument is exactly designed to go inside the sulcus. You rotate easily this instrument to the buccal contour, and with the rotation movement, you see the instruments going completely under the papilla in the buccal side, detaching the base of the papilla and the facial aspect of the bone, without any tensional damage in the top of the papilla. So this papilla elevator, this first one that I presented to you, we have one, a very nice additional one that I'm going to show in this sequence, is designed for you to lift the papilla facial, okay? So you go in the sulcus, detach the papilla, you can go to the other side and you can apply that very easily, very fast to detach the papilla. Here is a video. You're going to see this papilla elevator in action. Of course, it's another case, but you see really the papilla elevator going in the sulcus and detaching completely the base of the papilla, promoting more freedom of the tissue, more space for the tissue to be grafted. Okay, and if you accomplish this step, you can already go for the next tunneling instrument. This tunneling instrument is the papilla lifter, but in the top, okay, in the interproximal space. We call this instrument, we nickname this instrument rabbit foot, because when you get this instrument in your hand, you're going to see that, I don't know if I can show this in the video. Let me just get here. Maybe you're going to see a very small tiny feet here that go inside the papilla area. Okay, this instrument here was designed for you to go inside the sulcular area. You rotate the tip of the instrument in between the contact points. You rotate this instrument over the bone, and the tip of this instrument get in between the two crowns without damage any tissue on the surround, and you can move and detach the papilla, now not just in the buccal or facial aspect, but also you can detach this tissue in the top of the crest. Okay, and here there is one important thing that I need to say to you guys. There is some anatomical risk when you do this job here. What is that? It's not for you to be delicate or not be delicate. We need to be delicate, and you have the right instruments to be delicate using this way. The question is, depends on the width of the papilla, you can compromise the blood vessels that is supplying the papilla. Very narrow papilla, when you detach completely the papilla from the top of the crest, you compromise the blood vessels that came from the PDL. The periodontal ligaments are responsible for supplying the tissue all around the crown, and in a very narrow space, basically the PDL is supplying everything. It means narrow papilla. When you detach the narrow papilla, you are detaching the blood vessels that are supplying this narrow papilla. So narrow papilla, 1.5 millimeters below 2 millimeters. Every time that you detach all the way across from buccal to the palatal side, you can compromise the blood vessels, and you have higher risk to have this papilla with a necrosis. So my advice is, when you detach the tissue facial, no problem at all. The preview instruments you can use in 100% of the case. This instrument here, when you detach in narrow papilla, don't cross the top of the crest if the papilla is narrow. You're just going to cross the center, crossing to the palatal side or crossing to the lingual side if the papilla is wider. Then you're going to play safe, then you can handle your cases, and you're going to have minimal incurrence of necrosis or problem with your cases. But when you have a good papilla like this one, you see that you are bringing this instrument through the interproximal space to the palatal side, promote even more freedom for the flap to be advanced, and in case like this one, the space can be grafted. And you are doing currently nowadays papilla lifting. You are grafting under the papilla, respecting the anatomy, observing the anatomy with the right instrument, exactly with this kind of approach. Okay, nice. Of course, we already detached full thickness, the papillas, interproximal. Now I need to start the releasing, and is a tunneling. We are opting here for a microblade for doing this job. And after releasing all this tissue, this is a very interesting instrument, the spatula. Okay, the spatula currently now, this was the original design that you have from the spatula, and we are doing a small modification in the recent months here. Probably the new model is going to already be with a small curvature of the spatula here. Okay, it's not a big difference, but I think a small curvature in the spatula can help us to reach for different space. Ricardo, what this tool is designed for? Okay, if you're going to see here in the picture, you're going to see that the spatula is very sharp in the 2/3, and in this part is blunt. Okay, and why I'm going to need an instrument that is sharp. This instrument is for complete the releasing. When you work with the microblade, a tiny microblade goes in between the muscles, cutting muscles, detaching muscles, but usually microblade just cut around 2 millimeters sides and in the movement going forward. If you work in large in space, probably you're going to cross many muscles that was still attached from the flap to the base. Releasing can be nice, but a good releasing is when you have zero fibers interposed between the surface and the base, right? Between the flap and the periosteum that goes under. So this spatula goes inside this area, and these small fibers, this spatula can really cut it, right? Can complement the work that the microblade was doing in a fraction of seconds. So let's get here. I think we have a video. So in this video, I was finishing the preparation with the microblade. This is an implant together with some recession. We're going to lift this papilla as well. And after finish with the microblade, here you see the microblade finalizing, a few fibers on the way. I start to use the spatula. Okay, it's a full arch root coverage. So the spatula go in the sulcus, rotate, and you see 1 or 2 fibers, boom, the spatula can break it or can cut it. You see the spatula rotating over the frenum, and the spatula easily rotate over the frenum because there is no muscle fibers attaching from what is in the base to the surface. So the flap is completely free. If you do that, you're going to have amazing release in apical. Also, you have the full thickness detachment. You have detaching the base of the papilla and also the papilla interproximal. When you see here, for me checking in this slide, you see how huge is the releasing, how much the papilla is lifted from the original position, from the space that you can open that. So this is giving you the possibility in a few cases to graft even under the papilla, and you see this papilla here, seems that the papilla was not touched because the instruments are very delicate, and these are the instruments for doing that. Okay, so just here the finalization of the clinical case. We grafted the case, protection on the post-op. Here I have 2 weeks or 10 days of post-op and some small refinement here, checking the level, small gingivoplasty for the case, for us to have the case prepared to send for the dentist that refer the case for me. Okay, was a short video. Is just for you to understand the application of these different kinds of instruments, and you're going to see that everybody that is using these instruments has presented us amazing feedback. Remember, these are the most delicate instruments that you're going to find in the world, so please treat it well. Very delicate instruments deserve also that you respect when to apply this instrument. When you clean these instruments, don't clean these instruments together with the heavy instruments that you have for heavy surgery. Put separated in the box. It came with a very nice box here, and also I advise for you guys, if you have a machine that can wash the instruments, I already put inside the instruments here. I close the box and I put it straight inside the machine, not to need to mix with any other instruments as well. Okay, guys, thank you so much. If you had watched this video until the end, I hope I had contributed with something important, not just about the instrument, but give you some tips for your surgery. And I really hope that your skills find the proper instruments for you to have this synergetic combination about the skills, the fingers, the instruments.